Afternoon, everyone. So yeah, I'd just like to kind of give you a little introduction to the trials that we did with the Department for Transport as part of St Marys COVID-19 first lockdown. So this was using Windracers Ultra platform, which I'll show you in a moment. We're really trying to experiment to see how we could potentially set up an air bridge between the mainland and the Isle of Wight, so going from Lyon Solent to Binstead. And this is really part of the Department for Transport's Future Transport Zones project, which is kind of kicking off now, of which we've got an element on drones in there. So next slide, please. So we have the Windracers Ultra platform in the top left here. So this is being developed by colleagues here at the University of Southampton for Windracers. Charles Scales from Windracers is on the call as well. So it's a bit bigger than a bit smaller than a Cessna aircraft, to give you some kind of scale. And it's kind of being designed for doing kind of trunking. If you think of logistics, you've got your little point-to-point movements, but you've also got, if we look at the larger lorries going up and down the motorway network, this is the kind of platform we have envisaged here. So it's moving greater loads between different origin and destination points. So it's been particularly designed with kind of movement between villages and Africa in mind. It's been designed around this concept of trying to eliminate all single points of failure. So it has twin Briggs and Stratton petrol engines. It's got multiple flaps. It's got quite an innovative multiple autopilot system. And could you just go back again, just on that previous slide? That's it, thanks. And so it's capable of, the Mark II is being designed at the moment and should be completed soon, travelling around about 1,000-kilometre range and moving about 100 kilograms of payload. So think of it as a kind of a state car boot in terms of payload size. And you can see there we were loading kind of standard Versa packs, as Chris was saying, into the hold. The first actual crossing of the Solent was in the Believer aircraft, the small foam aircraft you can see there, with the first actual payload of a small rubber duck as part of our trials. But the Believer aircraft mimicked Ultra in terms of all of its avionics and all of its control systems. So we used that in all of our testing. And we undertook some loaded flights back in May, and then it was very much on standby in case the NHS needed it. So it was very much a proof of concept. And currently there's plans obviously for it to be now working, going over to the Isles of Scilly. Next slide, please. So just some kind of reflections, really, looking at some of the issues that we've discovered, but particularly working with the NHS. So my first point there is a bit controversial. Most drones are currently unsuitable for specimen movement, but what I really mean by this is, again, and Chris was alluding to this, it's understanding, and Jamie said this right at the beginning, what is the NHS problem? What needs to be moved? There's lots of very capable drone platforms out there, but it's very much, here's my drone, how might it be used in the NHS? You've really got to look at the products and what needs to be moved where, and that's very much dictated by the current packaging regulations, PI 650, the 3-layer packaging. We've been doing a lot of work with St Marys at the scope for moving aseptic medicines, and that's one key thing that's, I think, is quite exciting. Chemotherapy treatments. St Marys lost its aseptic manufacturing unit in July, so all of its chemotherapy treatments are coming from the mainland, and quite often patients have got to go over there for treatment, which is very restrictive for them. So, but then you've got to look at all the coolants, the coolant packages, and the Medicines and Healthcare Products Regulatory Agency stipulate how this is done, and trying to miniaturize that to cater for a drone platform, I think, can be quite restrictive. So we have to look realistically at the types of packaging. And again, some of the other core issue which is coming up, which we're all facing, is that the European Union Aviation Safety Agency will likely be stipulating that drones have to have some kind of crash-proof protective container to carry cargoes in. We don't know what the design specifications of that are going to be yet, so that's an important area. And the second one, really, in just the practicalities, and again, Alex mentioned this in his presentation, is the regulatory side. We're looking at dangerous goods movement here, and the reality of it is, and I know Alex is going for this at the moment with Skyports, there's no real drones been licensed to do this yet, and particularly for things like chemotherapy treatments. So, there's all that to be gone through, because it falls between the current kind of fixed wing and rotary wing regulations. So, how does a drone crew manage that? If the actual operation is press button and off the thing goes, how does that all tie in? So, and the final one, which I think is very, very important, is again the stipulations from the Medicines and Healthcare Products Regulatory Agency, the MHRA. What is the potential impact of your drone platform on the products you're carrying? And so not only have you got to get CAA approval, for the airworthiness of your craft, but also how can you prove that you won't have adverse vibration impacts from your platform on the products that you're carrying? And that's a very important part of that, and that's what we're currently doing. We're doing lots of trials looking at vibration and how that's passed through packaging, like things like VersaPack, to the products itself. So that all combines together really to kind of show what I think are two of the kind of areas that we've got to get over. The technology is very well developed. So there's lots of very capable drone platforms out there, but it's catering to it for the NHS need. And I think that's why it's an exciting time to be involved in this at the moment. So I hope that gives you some things to think about. Thank you very much.